I'm Dr. Price. I'm an interventional cardiologist here at Centra.
Myth or fact? I am too young to worry about heart disease.
That's going to be a myth. In the past, we used to think that patients in their 60s and 70s are the ones that had heart disease. Well, now it's not uncommon to see patients in their 30s and 40s. And that's not to scare anyone, but that's just to, think about how the disease process happens and the fact that it takes years to develop. So, if somebody in their 40s is found to have heart disease, well, that started a long time ago. And so it's important to think about the risk factors, keeping blood pressure under control, cholesterol, diabetes, taking a look at family risk factors. I think a lot of these are important to think about when you're young to try to prevent problems down the road.
Myth or fact? All fats are bad for your heart health.
That is a myth as well. There are healthy fats and there are unhealthy fats, and it's really important to know the difference between the two, and really pay attention to the foods that we're eating, especially in these days of having a lot of processed foods. So it's really important to know the distinction between the two, but that is a myth. Not all fats are unhealthy fats.
Myth or a fact? I should avoid exercise after having a heart attack.
That's a myth. So while there is a period of time where you'll want to take it easy after having a heart attack, and especially after an intervention, that allows the body to heal. There is good evidence that getting back to exercising and aerobic exercise is beneficial in the long term. And that's why we refer our patients to cardiac rehab, where it's a nice supervised, monitored program to get you back in the gym or back exercising at home. And so that can kind of set you up for good habits in the future to help prevent that from happening again.